The root cause is based on what's going on in your cells.
So how is your approach different?
So we're just skipping the stem cell step and going to the exosomes. There are some advantages. So a single injection at 15 years in the European study, over 82% of those patients were still doing great. They didn't have any issues needing surgery. Those exosomes get into our system and deliver at high proficiency into cells the phytonutrients that we need. So what's the problem here? Why don't we just take plant exosomes?
By 2050, 1 in 5 people will be over the age of 65. But the question is, are we just living longer or are we aging longer? Chronic disease now consumes nearly 90% of healthcare spending. Metabolic dysfunction affects more than 1 in 3 adults. And most people don't realize that their biological age, the age of their cells, can be very different from the number on their driver's license. We've been taught that aging is inevitable decline, slower metabolism, more inflammation, less energy, and more medications. But what if aging is not a fixed timeline, but a biological process we can influence? Welcome to the Uncover Your Eyes podcast. I'm your host, Dr. Meenal Agarwal. If you haven't already hit the follow or subscribe button, please do so. Let us know you're listening. It helps us bring you better episodes weekly. Today, I'm joined by Dr. Jeff Gross, a neurosurgeon and pioneer in regenerative stem cell and exosome medicine. This episode isn't just about chasing eternal youth. It's about biology. Thank you, Jeff, for being on with us today.
I'm happy to be here. Great to talk to you and your listeners.
So tell me a little bit about, I want to say I saw your platform, and your platform is called Get Young Again. What does that mean? Like, we cannot get young again. At least I don't think I can. So what does that mean?
So that's a book I'm working on. And my company, our practice, I rebranded about 8 years ago called Re-Celebrate, because we're celebrating the renewal of cells. But I started working on a book, and then I just got busy, and it's like 65% done. I just need to go away for a couple of weeks and finish it. But it's called Get Young Again. And so we put some of our content out on that channel. That's what you've seen. So
okay.
Focuses on healthy longevity, making small or even big changes or building up, making a plan and carrying it out if you not only want to meet your healthcare needs, but your healthcare desires. And healthcare could be prevention of the need for sick care.
Yeah. And, when we talk about getting young again, like we are talking about it at a cellular level. So what does that mean?
Well, we have symptoms as patients. We go to the doctor, this hurts or I have this cough. But the root cause is based on what's going on in your cells often. And if we can learn more about the cells, which I think in the last decade, we really have better testing, better analyses, and we can address those cellular problems and or even better, prevent them at the cellular level, then we have this enhanced knowledge. And so many patients come in sort of equipped with that, and when we're looking at supplements and diet and exercise and other, regenerative medicine or peptide approaches, we're treating the cells, and the body benefits, the organs and the tissues in the body benefits in the long run.
So how is your approach different?
Well, I've sort of reconfigured a tradition. I was practicing traditional medicine. As you probably know, I'm a neurological surgeon, spine surgeon. I do that, for decades, and I still see patients with neck and back problems. But I was never very surgical. I always wanted to try other things, making surgery the last option. And there were so many things out there in the world that my regular patients didn't have access to, and I was never trained to do. And going to annual meetings, neurosurgery conferences, we weren't learning and getting updated on these things. So I actually had to put down the Kool-Aid and have a paradigm shift and go learn about functional approaches and naturopathic approaches and regenerative approaches. So I sought it, I retrained, I re-educated, because I wanted to offer these tools to my patients for their neck and back and brain problems. Now that's all I do is treat a large growing number of issues well beyond neurosurgery using these natural biologic things that our cells and our body have had all along, and now we know more about them and we can strategize or re-encourage our cell systems to behave in a more restorative, youthful way. So that's the trick.
And how do you change the cells?
Well, we can change them by behavior. We can exercise or exercise differently. We can sleep with intention for restorative sleep, not just getting hours. We can improve our nutrition, our protein intake. We can do hormone optimization in the right and necessary group, and for both men and women. We can do hormesis, which is a slight stress on your cells to build adaptability and resilience for longevity, like fasting,
Mm-hmm.
like hot sauna or cold plunges or high intensity exercise or reduced exposure to oxygen, things like that. So we learn how to prepare our body for survival, meaning live longer and healthier, delay and prevent inflammatory accumulation, which is really delaying and preventing age-related disease.
And you talk about exosomes. Can you
Right.
explain what that is to me, and what are we looking at it helping in terms of aging?
Sure. So when we make all these changes, we eat right, we exercise right, we sleep right, we get the train, dialed in, the anti-inflammatory lifestyle, the anti-aging lifestyle. Sometimes that's not enough. They've accumulated issues. They have maybe a joint injury. They have some kind of autoimmune inflammatory burden. That's when we need some additional big guns, and we tap into what's called regenerative medicine. And regenerative medicine looks at how a baby is made, and I mean from the fertilized egg onward, not how you get to the fertilized egg. That's not the topic of this talk. um, People have that figured out, I'm sure.
Yeah.
So we take the fertilized egg, becoming an embryo and a fetus, and the cellular biology of what's going on there, involving a group of cells we call stem cells. And stem cells give a certain signaling through peptides, growth factors, and vesicles. They give off these little bubbles of information, of cargo, taken in by neighbor cells. And those are called exosomes. In this case, they're really stem cell exosomes. And we use that signaling now for someone who is not a fetus anymore. They're an adult, and they're having trouble. And all these, we'll call them free endeavors, exercise and sleep and all those things, aren't enough. And we hack the system by reminding their cells how to behave like they did when they were much younger. And that means encouraging them by giving them these signals to suppress the inflammatory activities of the cell, put them back into optimal, youthful, restorative mode. So we use exosomes a lot to do that. I do a lot of joint and spine procedures, injections to re-stimulate cartilage regeneration. We do intravenous delivery for inflammatory problems, helping with the body healing from autoimmune or long COVID or Lyme's inflammation and many other problems. And exosomes have incredible advantages, in fact, advantages over stem cells. Oddly, if I gave you some stem cells, you came by my clinic here in Las Vegas, and I gave you some stem cells in your vein, and we've done that, they'd be gone in a day or two. And you'd be like, hey, wait, I just paid all this money for stem cells. They're gone. But the benefits last, weeks, months, or longer. Some of the benefits can become permanent. How did that happen? If the stem cells are gone, how did that happen? Well, stem cells really aren't doing the work. They're delivering the message to our cells. Our cells get, realigned, they get re-educated, they get encouraged to behave better. So when we do that through these signals, through the peptides, the growth factors, and the exosomes, so we're just skipping the stem cell step and going to the exosomes, there are some advantages. Advantage one is exosomes are much smaller than cells. They can cross the blood-brain barrier. They can get to the nervous system. Two, they're less expensive. That's good. Why? Because they're much more abundant. They come from amniotic fluid, pumped out by the stem cells in the umbilical cord. And three, they travel through tissues better. They don't get hung up in the heart and lungs like the stem cells do, which is great for the heart and lungs, but the rest of the body doesn't get the
Get it.
love. So that's one of the main approaches to regenerative medicine and longevity that we're doing here at Recelebrate.
And how does one know that they should go towards stem cell therapy versus exosomal therapy?
Well, they're on the same par of sort of strength,
Okay.
and one should work with a clinician and go over the options through informed consent and decide what's best for that particular problem. Look at the literature, medical evidence. And sometimes clinics don't have access to what I have access to. So
Right.
I'm sourcing biologics of specialty kinds constantly. So we have the latest and greatest materials in our offerings. But some clinics don't have that. They only have stem cells, or they only have low dose exosomes. So, quality counts, the number of particles count, the testing counts. We use very, very high quality materials from non-COVID vaccinated mothers having a C-section. Congratulations, here's your baby. By the way, we were going to throw away your umbilical cord, your placenta, and your amniotic fluid. It's trash. Can we have it? It's treasure now. So it's a donation process. It's monitored through tissue bank agencies. It's highly regulated. These go to FDA regulated and certified and registered labs in the US. And those labs have to handle and document things perfectly. And they do testing. Every virus you could think of is tested. They do 2 weeks of quarantine, endotoxin testing, so there's no infection, cultures. And they only make those available to us if they meet all those criteria. So, and I'm just giving you the highlights. Like it's
Yeah.
in depth. So we only use the highest quality, high count materials.
And is this something like you were saying in some cases it's an injection for some people? Is this
Right.
something that they have to do, like you said, lasts a day, but the effects last long time? Is this something they have to do every year, or how often are people doing this?
Well, about a third of my practice is musculoskeletal. So we're seeing joint degeneration slash loss of cartilage slash injuries slash prior surgery slash, I hate this word, arthritis,
Hmm.
because it doesn't tell what's going on. The process of osteoarthritis is a metabolic dysfunction of the cartilage forming cells. So you make a joint, you make the cartilage, you you maintain that cartilage. You can heal it when you're young if you tweak it, but when you're older, at some point those cells just are too inflamed. They don't work. It's kind of one of the early signs of inflammatory accumulation. Well, we can help reverse that cellular activity and flip those cells back into optimal mode to make cartilage. Remember, cartilage is just a protein.
Right.
So injecting into the joint has been proven not to be as useful as injecting into the bone edge. So they have 15-year follow-up studies in Europe on this. It's well demonstrated in medical evidence. So that's what we follow, the best protocols. And we have shown in a single injection, which is the root of your question, that we have at least as good a results as they have in Europe. So a single injection at 15 years in the European study, over 82% of those patients were still doing great. They didn't have
Wow.
any issues needing surgery. So we're following that protocol. Now, might they come back in 20 years and need a repeat? Perhaps, but this is not something we have to do because of the protocols we follow, the materials we're using, how we do the targeting. This is called precision medicine. This is not fuzzy or ultrasound guided. This is MRI guided at the highest levels.
And what type of exosomes are you sourcing? Like in terms of, like, I know there's plant derived, there's human derived, and
Yeah.
there's different types. What do they mean, and how do you know, which are the best?
These are the for the true regenerative, kind of stem cell activity through the amniotic fluid, which has exosomes and growth factors. This is an amniotic fluid filtered source. Fresh frozen amniotic fluid is what we're using, like putting you back in the womb. Those are human.
Hmm.
Like I told you about how we get them from the various vetted labs here in the U.S. We also now I stumbled upon plants make exosomes, but that's a bit separate. So plants deliver nutrients to us that we need and help our biology, and we call those, as a group, we call them phytonutrients.
Okay.
Phyto meaning growth or plant growth, and nutrient, of course, speaks for itself. So these phytonutrients are like flavonoids, polyphenols from berries, and many others I can barely pronounce. Things in green tea, things you find in pomegranate. I know you did a show not too long
Yeah.
ago on some of the polyphenols in pomegranates. I think it's ellagic acid is the root of that, and your bacteria in your gut convert it. Like a lot of things are going on. We need all that. So these plants produce these phytonutrients in an exosome, a plant-derived exosome that's encapsulated with a membrane. Why is that important? Well, let's think about traditional supplements. We go to the vitamin store together. We're picking out some supplements for you. Let's say I've heard resveratrol is good for anti-aging. I want to get a bottle of resveratrol capsules. And it comes from red grapes and it's a phytonutrient. So how did they make that resveratrol? Well, they probably took a bunch of grapes, squished them down, used some solvents, and broke open the exosomes to pull out the resveratrol so they can give you a capsule of resveratrol and say, this is a 90% pure capsule. Here's the problem. You eat it, you lose a very good amount in your digestive process. And most of it doesn't even get into your system, into your bloodstream. Then the remaining is floating around in your bloodstream, not getting into cells. Why? Cells are an incredible barrier. They're like our skin. They don't let things in unless they want them in, or they're designed to go in. That's why we've evolved around plants. Plants make these phytonutrients in an encapsulation. So you barely get these things if you're taking them in a traditional supplement. And that's why we talk about expensive urine, right? Now, some vitamin companies figure out, if we put a little membrane on it called a liposome, because it's a bunch of fatty membrane, your cells get more of it. And that's true. So think about that. They had to break it down out of its encapsulation to put it back in a new encapsulation so you could take it. Well, that's really a long way to go for what nature's already figured out. Nature's already put it in an exosome, nature's liposome, or a liposome is a synthetic exosome. Those exosomes get into our system and deliver at high proficiency into cells the phytonutrients that we need. So what's the problem here? Why don't we just take plant exosomes?
Yeah.
Because they were until recently, very difficult to extract just the exosomes. They are measured in nanometers apart. They're called nanoparticles. They're very difficult to separate. So I fell into this. I'm a nerd. I dug deep and I found a lab that could do it for us in Italy. And so we sourced organic Italian fruits in the blue zone of the Mediterranean, right? The longevity fruits, papaya, mango, a ton of citrus fruits, known to have vitamin Bs, except 12, because that's not exosomal, polyphenols, quercetin, fisetin, spermidine, glutathione, all these things are in the exosome. And we're able to provide it in a single daily capsule now, the only exosome supplement for our cells. This is separate from the regenerative capacity of the human exosomes. This is a incredible phytonutrient delivery. It gives you 700 to 4,500 times the phytonutrients to your cell than a traditional supplement. So we call that longevity exosomes, or for short, LONGEVEX. So that's a
But
product
this
we
is
came
a
up with.
supplement as well, right?
Right. It's only a supplement. That's all we're doing with the plants right now. We're working on some others, but right now, just the longevity daily capsule. And it's been a big hit. So we launched it less than a year ago.
So if it's a capsule and you're taking it, does it not also go through the digestive tract and become less, bioavailable then?
Great question. Plant exosomes are hardier and do not get digested with any significance. So they make it through the intestinal barrier at high bioavailability. We did the math on this, and that's why I can quote 700 to 4,500 times the delivery. That includes avoiding digestion. And by the way, our microbiome, our bacteria in our gut use them too. So we're helping them as well. There's a lot going on. And the preclinical studies were great. We showed increased SIRT2 gene activity, which is a mitochondrial anti-aging gene. We showed reduced reactive oxygen species, so improvement in cellular stress, cellular damage. So we know these are longevity markers that we're shooting for.
And efficacy wise, is plant versus human one more effective than the other?
different different pathways, right? The
Okay.
human ones are doing a regenerative anti-inflammatory, you know, stimulation of the right pathways and suppression of the bad pathways in the cell. The phytonutrients give us what we need from plants that we're not getting enough of, even if we take regular supplements. And you couldn't eat enough fruit in a day. Of course, there's a lot of sugar there too. You couldn't eat enough fruit. It's something like 7 bushels of fruit. um, the exosomes in one capsule that we have
Mhm.
are like 7 bushels worth of fruit. So you couldn't drink enough fruit juice. You couldn't eat enough fruit in a day. You just you'd have a lot of other problems.
And who needs this?
We all need it.
So everyone
I
should be
mean,
taking it.
yeah, I guess unless you been living in the blue zone for your entire life, but this delivers the phytonutrients that we're just missing. At least from a longevity perspective. We're looking at other ones now, actually, in the anti-inflammatory families. The exosomes from curcuminoids, turmeric, and
Mhm.
ashwagandha, and other items. But we're working with the lab to make sure we can extract the exosomes. So that's a secret. That's in our pipeline, but that's coming too.
Okay, so if I just want to understand this. So if you're extracting exosomes from, say, turmeric or, something else, what are the differences in those? Like, how does one know they should be taking exosomes? Like, are they all the same mechanism?
No, well, different phytonutrients have different benefits in our cells, but they all have common pathways, right? Which is to improve the enzymes that we need in our cells and the anti-inflammatory cascade, the antioxidant cascade, and ultimately reducing the source of inflammation. And if you look up the definition of inflammation at the cellular level, it's an increase in a small nuclear factor called NF kappa beta. So all of these things have a final common root pathway to suppress NF kappa beta. The human ones do too. So that's where they meet up, is
Hmm.
suppression of inflammation. And we say inflammation, what's inflammation for the average listener? That's what's aging you at the cellular level. And it can be manifest at the body level, right? You can bang your arm and have redness and swelling and that local inflammation, but cellular inflammation is really where the damage is happening.
What are some myths that you feel, people believe that's preventing them from exploring these options?
Well, first, people think that stem cells or biologics related to stem cells like exosomes are illegal, at least here in the US. That's not the case. What's improper or non compliant is making a marketing claim. So the FDA approves marketing claims, and they have not yet vetted any marketing claims for PRP, exosomes, stem cells, supplements. So we can't make any claims. But as a physician, I've never made claims, right? I've done surgeries. I've done, this and that. And the many things we do aren't approved for marketing claims. So people throw around that phrase marketing, or sorry, they throw around the phrase FDA approved, but they don't finish the phrase FDA approved for marketing claims. The FDA does not approve or disapprove what clinicians, physicians, doctors, and other health providers can do or what patients can receive. In fact, there's separate law called the Right to Try Act where patients, when they have fully informed
Mm.
consent from the clinician, meaning all the options are discussed, they can have those things. So I think a lot of companies misuse that FDA approved. Claims are usually brought forth by a company making a drug or a device, not necessarily clinics. So when we put out our supplement, we have a label on our bottle that the attorneys wrote that says we're not allowed to make any claims. When I offer someone a joint procedure, a spine procedure using exosomes, we're very clear that I'm not making any claims that I'm treating or curing a disease or condition. Can we help the body heal and remind it how to, work more usefully? Sure, we're helping that at the cellular level, but we don't make claims. So that's hugely misunderstood.
Right.
And by the way, just because the FDA hasn't approved something doesn't mean it's unapproved or disapproved. It means they haven't looked at it yet. It's neutral.
Yeah.
So all things considered equal, we still have some freedoms left. We should enjoy them for our health and longevity benefits. So that's probably the biggest myth out there, and I'm glad you gave me an opportunity to
Yeah, that's
educate.
interesting. Yeah. In If you could give one piece of advice to someone in their 30s that they should do today to help with aging, what would that be?
Exercise hard. Use those muscles to failure. High intensity intervals. One set of resistance to failure instead of 3 sets of 10. Move, move, move. Got to keep it. If you move, your body will adapt and keep you alive. If you stop moving, and I'm guilty of it. I'm sitting in a chair right now in my desk. I do a lot of telehealth, and we really need to keep moving. And the other things I would say, of course, eat clean, eat a lot of protein, maintain your muscle mass, which goes with the movement, but you need the protein,
Right.
and just and avoid things that are bad for you.
And what's one thing they should stop?
They should stop stressing out. There's too much anxiety, too much
Wish we could all
addiction
do
to
that.
dopamine. Yeah, stop, chill out, get some mindfulness, some lonely time, sit within yourself, learn how to do that. Before we had cell phones and streaming, kids went out and played, and sometimes they learned to be by themselves. They had to wait. They had
Yeah.
patience and mindfulness.
I say that to my kids all the time. Learn to be bored, right?
Yes, exactly.
Thank you so much, Dr. Jeff, for your time today. Can you tell our listeners where they can find you?
I'm going to tell your listeners, we hardly scratched the surface. There's so much more to talk about. We didn't even get to peptides, but there's so much going on. We love to meet new people. So our company is Recelebrate, ReCellEbrate. And I think we pretty much cornered the internet on that word. So recelebrate.com, at Recelebrate on all your social channels. Like and follow us. Reach out. Happy to meet new people. If you mention that you heard me here on Uncover Your Eyes, I'll be happy to have a 30-minute conversation with you at no charge. If you can schedule it within 30 days after this episode drops.
Perfect. Thank you so much, Dr. Jeff.
Thank you.
Thank you, listeners and viewers, for tuning in. If you want to catch more episodes of Uncover Your Eyes, make sure to follow or subscribe on your favorite podcast platform and on YouTube. To learn more about me, follow me on Instagram at Dr.Meenal Agarwal. Until next time, keep those eyes uncovered.